wanted to backtrack on restlessness and agitation in the dying patient. Those symptoms are real. We have medications to manage that. Typically, we use lorazepam. Quick in, quick out, very effective, typically in managing symptoms. Mild restlessness kind of might look like this, or fidgety. Agitation could be more of uncomfortability, physically or emotionally. Again, we have to be detectives or put pieces of the puzzle together. Is your person clean, dry, comfortable, skin intact, constipated? Rule all that stuff out. And then we'll say, okay, what's going on? We'll be able to assess him deeper. Get a call from my office. This patient's daughter called, said her father is trying to pull his tongue out of his mouth. Now, that is not normal behavior. Restless or agitated, that is not normal behavior. Something is going on with him. That call required a follow-up visit. So I went to the patient's home, looked in his mouth. I suspected he either bit his tongue or developed a thrush. And he did develop thrush, which is an infection in the mouth, typically caused by a weakened immunity and an imbalance of the good bacteria. It presents white spots or sores on either the tongue, gravelly tongue, on the cheek. It could go down the throat as well. If he was able to swallow, it's a liquid, we would tell him to swish and swallow. He couldn't swallow. So the next best thing was to have him, I brought props, used the oral swab with the suspension and paint it on his tongue and in his cheeks, the cheek pockets, and get the medication on it that way. And if you clamp down on it, you don't want to pull it out. This is pretty tightly adhered, but you don't want to pull it out. And again, patient at the end of life, their mouths are usually open because it does take a lot of muscles to keep the mouth open and close it. So typically the mouth is open, but instinctually, if you put something in the mouth, it might clamp down. Don't pull it out. Eventually, they'll open their mouth and then just take it out. So we ordered the nystatin. She painted it on his mouth, and within 24 hours, he was sleeping very, very comfortable. So again, the more you know. And if you don't know, call and we'll figure it out. All right. Have a good day.